My name is Dr. Kate Fadaka. I'm a child and adolescent psychiatrist. Today I'm going to be talking about ADHD in children and adolescents. So ADHD stands for Attention Deficit Hyperactivity Disorder. This is a neurodevelopmental disorder that affects children, and it can continue into adulthood. It is characterized by persistent patterns of inattention, hyperactivity, and impulsivity that interferes with daily functioning or development of the young person. These behaviors they are more intense and frequent than would be typically seen in the young age group of a young person. So the diagnosis for ADHD has to do with severity and intensity of these patterns of behavior. ADHD is not as a result of poor parenting or lack of discipline. Rather, it's believed to be caused by a combination of factors, genetic, neurological, or environmental factors. The exact cause is not known. The symptoms vary widely amongst individuals, but they generally fall into three categories. So inattention, hyperactivity, or impulsivity. Inattention, like the child finds it difficult to focus on tasks or play activities. They make careless mistakes in their schoolwork, frequently losing items, such as pencils, coming back home without their school bags. Some do. Failing to follow through on instructions, easily distracted, have difficulty sort of organizing themselves day to day. Hyperactivity, in the younger age group, they are quite overtly hyperactive. So you see them climbing things, jumping, not being able to play quietly. But in the older age group, like the adolescents, that's overt hyperactivity is less. So you see them restless, kind of shaking their legs, not being able to sit still, not being able to sit through meals. They walk around eating, standing to like do stuff, moving from one chore to the other without finishing any. And then, you have the impulsivity where they can't wait their turn, they can't stay on a queue. In the classroom, they shout out answers, they talk over people, they finish sentences for their peers, they are very talkative, and all that affects their peer relationship. So those are the common symptoms of ADHD, and you have different, depending on what the young person presents more with, so you can have the combined type. So when you have both hyperactivity, impulsivity symptoms being present in similar level, so inattentive symptoms, then you can have the inattentive type, where it's the inattentive symptoms that are more than the hyperactivity, impulsivity symptoms. And then you can have the hyperactivity, impulsivity type, which is more of the impulsivity, hyperactivity symptoms that are present. Like I said, these are severe persistent symptoms, and a diagnosis is given through comprehensive assessment, following screening and, getting screening information from family members and collateral information from school, commonly, sometimes as well from social activities the child may be involved in within the community. Adults from there can give feedback as well to help with the holistic assessment. And once we get all the information back and it reaches the threshold for further assessment, that's when assessment is done. So it's important to clarify here that the fact that the child has some inattentive symptoms or hyperactivity symptoms does not mean that they will necessarily meet criteria for further assessment for ADHD. Is the threshold that determines how further the assessments will go. So that's important to note. And also, during the full assessment, we go through the full psychiatry history, looking at the medical side of things, physical health, making sure that nothing else is happening that may mimic ADHD. Like if you have thyroid problems, hyperthyroidism, you can be fidgety, you can be restless, you can, all that. So physical part of the assessment is important, where we ask all those questions, from the family. And once the assessment is done, we use, criteria. There's a diva for young people. That is a tool that can be used. There's the We use the DSM-5 criteria as well. So we do the assessment based on those tools, and looking at the feedback as well. Like I said, it's a progressive disorder, which means it happens it's not just going to be happening at home. So it must be happening somewhere else apart from home for it to meet the criteria. And once the diagnosis is made and a child meets the criteria for a diagnosis of ADHD, which means the symptoms the child is presenting with, there's nothing else that could be causing it rather than ADHD. So it's not anxiety, it's not learning disability, So you have to make sure it's not any of those ones before you give a diagnosis of ADHD. And once they meet the criteria, then the treatment is three-pronged approach. So you have the medication treatment, you have the behavioral therapy, and then you also have the reasonable adjustments in schools. Common ones, medications we use are stimulants, and we also have the non-stimulants for those that don't tolerate stimulants, or those that have that have sort of side effects to stimulants. Because a child is growing, the common side effect is loss of appetite, and if that's significant, we tend to switch because you don't want the child's growth to be impeded because you are treating for ADHD. And the other thing as well is behavioral therapy to help them sort of learn to manage their impulses better, and also knowing how to be more organized and keeping themselves focused on their daily tasks. And the other thing as well is the reasonable adjustments in school. So sitting position for a child with ADHD is important. They need to sit near the teacher so they are not distracted, because if they are sitting behind, you definitely not be concentrating on what's happening in front. So that's important. Time outcasts to stretch their legs is important. Extra time for submitting assignments and in exam as well is important, just to make it easier for them to manage, to maximize their learning potentials. So treating people with ADHD will collaborate significantly with education, because the reason for treatment is actually for them to maximize their learning. Because ADHD symptoms can really impede understanding, sitting in the classroom, concentrating, and really reaching your threshold. And, if you don't treat ADHD, what will happen? Mild symptoms of ADHD, the young people can manage without medication, but moderate to severe, most times they can't, because they will miss out from maximizing their potentials in learning and meeting good grades, having good grades in their exams, and sometimes they start self-medicating because they just want to calm their brain down, So what they do is they start using illicit substances, to calm their brains, because ADHD brain is like you having several signals at the same time going on within your brain, telling you do this. The other one is saying, oh, you need to do this now. So it's very chaotic in their minds and their brains. So they are very prone to trying to self-medicate to manage that. So that's why it's quite important that once a diagnosis is made, treatment is actually recommended. And they tend to do well, or those that tolerate the medications and take it, they tend to do well and improve in their symptoms. And as young people grow older, they tend to understand themselves better. They tend to know how to help themselves stay organized using all these organization apps that are now sort of available. And so the trajectory is actually better, with the technological advancements of lots of apps that are helping people with ADHD these days. So I think for young people that have inattentive symptoms, impulsivity, and parents, and there's a strong family history, it's imperative that they get screened to see if they have ADHD so they can get treated, because they actually get better when they are treated. Thank you.